Wisconsin, as in some other states in this country, nursing assistants are allowed by law to apply certain medications to the skin. Hi, I'm Kathy Getrist, and today we're going to be talking about topical applications of medication to the skin. These medications are called topical medications because they are used on top of the skin. Today's discussion is going to cover the important information that you need to know in order to apply these medications to the skin safely and accurately. Well, why would topical medications be used on the skin to begin with? There's a number of reasons why topical medications are used. The first might be to soften and destroy the outer layer of the skin so that it can shed. An example that you might be aware of is the use of compound W or other medications such as that to remove outer layers of skin for folks that have corns and calluses on their feet. Another might be to protect the skin. The medication does not penetrate through the skin layers or soften it, but instead it forms a long-lasting film on the skin. This film protects the skin from moisture and germs. Sometimes you'll see that used in a long-term care facility where you have residents that are incontinent of urine and stool, and there's a hazard of the skin breaking down when those waste products getting direct contact with the skin. So after cleaning the perineal and rectal area thoroughly with soap and water and dried, this film is sprayed on to the skin, and when the person is incontinent, then it cannot go through to the skin layers. Another reason for applying topical medication might be to relieve itching. Itching might be caused by inflammation. For example, you're probably knowledgeable about the medication calamine lotion that's used for itching for things like poison ivy. Another use is to reduce inflammation. Inflammation can be reduced by suppressing the body's natural reaction to inflammation. Something like hydrocortisone cream that's used for the treatment of bug bites. Another reason for using a topical medication would be to reduce the growth of microorganisms, any kind of germ on the skin. Alcohol or povidone iodine, you're maybe more familiar with its name called betadine. Those products may be placed on the skin to disinfect and to clean the skin. Sometimes if a patient is going for hip surgery, they'll have a cleansing medicated wash to the skin prior to that surgery. Also, topical medication might be applied to reduce pain by numbing the skin layers. Solar cane is an example of that can be applied to the skin for a severe sunburn. Also, you might have medication applied for the use of killing insect parasites that infest the skin. An example might be the use of Quell shampoo for someone that has head lice because it can kill the head lice parasites. There are two effects of the use of drugs on the skin. One is a local effect. Local means that it does not enter the bloodstream and go to other parts of the body. It stays right on the skin. Few drugs actually that are applied to the skin are intended to go into the deeper layers. Most of them are applied for a local effect. They remain local and are restricted to the skin surface itself. Another effect of the drug, however, might be a systemic effect, and that's where there is absorption of the drug through the skin and into the bloodstream, and then it travels to all parts of the body. Drugs for the skin are prepared in various forms. The form that is chosen for a topically administered drug depends on the desired therapeutic effect. There can be creams, lotions, ointments, aerosol sprays, foam medications, or pastes. Skin patches are another relatively new, well, within the last 5 to 10 years, I should say, whereby medication is being administered with a patch that's placed on the skin. In the past, taking medication by mouth was the only way of taking something orally. Now they're available in what's called a transdermal patch form. And the patch is an easy and convenient way to take medications, particularly for individuals who have difficulty taking medication by mouth. A Nicoderm patch that you may be familiar with to help decrease the craving for cigarettes would be an example of a type of transdermal patch. Applying or removing any of these patches is the responsibility of the nurse. However, if you notice that a patch is falling off, or if a patient is complaining of burning or itching underneath the patch, you would certainly want to report that immediately. Preparing and administering topical medications requires your full attention. The 5 rights is a traditional checklist that for years has helped ensure accuracy in drug administration. I'd like to review those 5 rights with you. First, and probably most of all, you want to make sure that you have the right patient. That means check the identification bracelet, and if you are unfamiliar with the patient, ask them to pronounce their name if you know that they can do so responsibly. If the patient asks questions about the medication, be sure that you recheck prior to progressing. Maybe they know that this is not a medication that they have taken in the past. Might be a clue that you might have the wrong patient. The second right is the right drug. If the nurse asks you to apply vitamin A and D ointment, it's your responsibility to read the label on the container to confirm that in fact you do have that correct medication. If there is no name on the container that you are asked to use, you may not use it, and you'd want to report that. The third right is the right time. If it's ordered to be applied at a certain time, for example,